Today we will assess the musculoskeletal system. First, we will inspect the patient's base of support and alignment of the feet. We will also observe the patient's gait. If I could have you take a few steps forward, turn around, and walk back, please. Okay. Now, there is no hobbling, no limping, and no other signs of pain, distress, or asymmetry of the muscles used in walking. Patient has a normal gait. We will now inspect the range of motion in the joints of the patient's upper body. To do this, you'll need to direct your patient to move in certain ways. If I could have you please roll your neck in circles. Take your chin to your chest, and then look up. Okay, very good. So we see a full range of motion in the neck. Can you make circles with your arm? Both sides? Okay. All right, so that shows a full range of motion in the shoulders. And can I have you bend your elbows from all the way in to totally straight? Okay. So a full range of motion in the elbows. And can I have you turn your wrists? Okay, a full range of motion in the wrists as well. I see your fingers are curled in. Can I have you straighten them out and curl them back in? And can I have you move your thumb from flat palmar all the way to the surface? Very good. So a full range of motion in the neck, shoulders, elbows, wrists, and fingers is noted. And can I have you twist from side to side in your back? Okay. And can I have you lean forward? Can I have you lean backwards? Okay. This shows a full range of motion in the vertebral column as well. Next, we need to inspect the patient's hips, knees, ankles, and toes for their range of motion. Could I please have you turn at the hips with your back straight? Don't twist your back, just turn at the hips. Okay? All right. So we have a full range of motion in the hips. Could I have you please lift your knees? Okay. Also good evidence of normal range of motion in the hips. Okay. Please lift your foot backwards and grab your ankle. Okay. And repeat on the other side, please. Okay. This shows a full range of motion in the knees as well. And can I have you lift your foot and turn your ankle in small circles on both sides? Okay. And if I could have you lift your foot and curl your toes inward. Okay. All right. Good range of motion in the hips, knees, ankles, and toes. It is important to palpate the joints of the upper body for crepitus throughout their range of motion. To do this, you place the hands over the joint as it moves through its range. We'll start with the neck. I could have you lower your chin to your chest and look up. Make small circles with your neck. Okay. Make large circles with this shoulder. Okay. And this shoulder. Okay. Please curl your elbows in and all the way flat. Okay. Please rotate your wrists. All right. And extend your fingers and curl them back in. Okay. Extend your thumb and curl it back in as well. Thank you. If I can have you lean forward. Okay. And lean backwards. And twist at the spine. Okay. I don't notice any crepitus or crackling sensation inside any of this patient's upper body joints. Down here we'll be assessing the hips, knees, ankles, and toes for crepitus. Lorianne, please turn at the hips. Okay. And please lift your knees. Okay. And please lift your ankle. Okay. Okay. And please turn your ankles in small circles. All right. And curl your toes in. And curl your toes in. Okay. As you can see, I'm palpating the joints as they're being used. I don't feel any snap, crackle, or pop inside the joint itself, so this patient is negative for crepitus in these joints. Next, you need to inspect and palpate for scoliosis. That is any lateral curvature of the spine. This is done by having the patient stand with their back exposed, and first visualizing the back for symmetry and straightness of the spine. This patient's back appears pretty straight. Now we want the patient to bend over and again observe the spinal column. Still looks pretty straight. Now you can palpate one vertebra at a time up the patient's back. The vertebra should proceed in a palpable straight line, midline through the back. Go ahead and stand up, please. Okay. This patient's spine is straight and does not curve to the left or the right. So this patient would be negative for scoliosis with this test. If there's any abnormal range of motion, the specific range of motion needs to be measured. There are devices for this. Goniometers can measure a specific range of motion. For this patient, there is a full normal range of motion. After range of motion testing comes strength testing. And for this, the patient needs to be pushing against resistance. And you want to grade the patient's large muscle group strengths from 0, which is no muscular contraction, to 5+. 5 is considered a normal muscle strength. We'll start at the neck. Please push your head against my hand. Okay. And again over here. Okay. And forward. Okay. And backward. Very good. This patient shows a 5+ strength in the neck. Please push up against my shoulders. Okay. There's a 5+ strength in the shoulders as well. And with your hands on both sides, please try to curl your arms in. Okay. Please try to straighten your arms out. Okay. Resistance points at the wrist for flexion and extension help assess the strength of the biceps and triceps, respectively. You also need to assess strength in the lower joints as well, in the hips, knees, and ankles. To do this, the patient must push against resistance at these joints using large muscle groups. Okay, Lorianne, I'm going to place my hands on your hips, and I'm going to ask you to try to push your hips forward. Okay, and try to push your hips backwards. Okay, try to turn your hips. Okay, very good. Lift this knee. Okay, and this knee. Very good. Next, you need to assess the patient's ankle strength. This is done by placing your hands over their feet and having them curl their toes upwards or otherwise lift their feet against the pressure of your hands. Very good. This patient indicates 5+ strength in the ankles, knees, and hips. Next, we will assess the patient's cerebellar functions. This is done by having the patient walk heel to toe with the arms at the sides with the eyes open. And then repeating the test with the eyes closed. Loss of balance would indicate poor cerebellar function. This patient has good cerebellar function and can balance with her eyes closed, despite the difficulty of her task. This has been our musculoskeletal assessment.